Hi all, welcome to Physio Exam Buddy. This video mainly focuses the difference between the upper motor neuron as well as lower motor neuron. First of all, we will see what is this upper motor neuron or UMN. The neurons mainly present in the brain and the spinal cord, which will activate or inhibit the alpha motor neuron or the corresponding cranial nerve nuclei. They constitute this upper motor neuron or the UMN. And they mainly include our descending tracts like pyramidal tract as well as the extrapyramidal tract. That is the neurons coming from the brain as well as the spinal cord, which will either activate or inhibit the final output, that is either the alpha motor neuron or the corresponding cranial nerve nuclei. Lower motor neuron means basically the spinal as well as the cranial motor neurons that is directly innervating the muscle, especially our alpha motor neuron, which is present in the anterior horn of the spinal cord. They constitute the lower motor neuron. Now about the differences between UMN and LMN. You all know that UMN is upper motor neuron whereas LMN is the lower motor neuron. The site of lesion in case of UMN lesions will be either in the pyramidal tract as well as in the extrapyramidal tract. Whereas in case of LMN type of lesions, the site of lesion is mostly in the anterior horn cell of the spinal cord. In case of UMN lesion, it is mainly the paralysis of movements rather than the muscles, and it is commonly referred to as the paresis. Whereas in case of LMN, it is the individual muscles or group of muscles which get paralyzed. In UMN type of lesion, you will get hypertonia, that is increase in the tone of the muscles, which is commonly known as spastic paralysis. Whereas it will be flaccid paralysis in case of LMN type. And all the deep tendon reflexes will be exaggerated in UMN type, whereas in LMN type, these tendon reflexes will be absent. Regarding superficial reflexes, it will be absent in case of UMN, and in case of LMN, depending upon the site, it will be either absent or present. Next is about the plantar reflex. In case of UMN, you will get a Babinski sign positive, that is extensor plantar response. Whereas in case of LMN, it is the normal flexor response we get while eliciting the plantar reflex. In UMN, there is no wasting of muscles or disuse atrophy, whereas you will get marked wasting as well as atrophy in case of LMN type of lesion. And there is no reaction for degeneration in case of UMN, whereas the reactions of degeneration will be present as well as fasciculations and fibrillations may also be present in cases LMN type of lesions. Thank you.